also, it should be going live right now. It's prepping. And give me a second. Refresh your Facebook Live. And give me a thumbs. Okay, it's up. So go ahead and share and give me kind of a thumbs up, and then we'll start. I'm admitting all into the room too. Okay. All right. Welcome everybody to this this panel discussion. We're really excited about speaking, especially a topic very dear to my heart, depression and COVID-19. And so we have a great group of panelists, and I'd like to really quickly go through an introduction for each of them. If you could raise your hand or just say hi as I am saying your bio. So we have Dr. Pranab. He's a medical doctor working in Nepal, and he is, ever since he's completed his medical degree in 2011, he's been working in the area of mental health and providing psychiatric care in both urban and rural areas of Nepal. He also has his master's in public health degree, and he's keenly interested in addiction medicine and conducted research work on recovering substance use disorder. And he has a strong inclination towards Buddhism and loves hiking and trekking. So welcome, Dr. Pranab. We also have Kim Crosby. Thank you. Kim Crosby is a regression therapist and speaker, and very passionate about working with the consciousness. She's developed a method which allows her to map a person's belief system. Beliefs, like in nature, have patterns, and in search for the core negative belief, she helps her clients transform them to become more authentically happy. She's been doing this for over 10 years, and it's transformed her own life. Please welcome Kim.
Thank you.
Dr. Khalid. Dr. Khalid is also in the psychology or psychiatry field. He is a primary clinical and research interests include attention deficit and hyperactivity disorder, autism spectrum disorders, and developmental disabilities, as well as depressive disorders in children and adolescents. He's very active in suicide prevention and global mental health and child adolescent psychiatry training. Dr. Khalid is also a reviewer of several recognized peer-reviewed journals. Welcome, Dr. Khalid.
Thank you.
We have Shemine. Shemine is a teacher researcher, and she's passionate with working with children and youth and their families in a meaningful and supportive manner. And with engaged care and counseling, she offers a various of services from individual to group support. Research interests in child and youth care, intersectional feminism and race studies, as well as therapeutic recreation, specifically looking at recreational and leisure experiences of the immigrant youth. Please welcome Shemine.
Thank you.
And then we also have Neda. Neda is a transgressive writer, lecturer, and researcher. And she writes, creates, and builds worlds in imagination. Writing is her soul, creating is her passion. And she writes to explore the human mind and writes to reveal what's beneath the beautiful mask of all of us. She uncovers the darkness within us, and she just loves words. She dares to be brave, and she dares to say what others are afraid to say. Please welcome Neda. All right, so I asked all of our panelists to share one thing that they learned about themselves last year. 2020 was hard for a lot of people, and a lot of people actually really thrived also in 2020. But I think a lot of us learned something about ourselves. And so I want to start with Khalid. What is one thing that you learned about yourself this last year?
Well, challenges brings opportunities. This is the one thing.
Yeah, what do you mean by that?
So sometimes people, when they're facing challenges, difficulties, some of us humans feel despair and hopeless, helpless. But if you allow yourself to see beyond that moment, you will see many, many doors are actually waiting for you to be open, to be to go through. And this is what has been confirmed to me and to many others have been talking to during this difficult time, to all of us. I hope I made it clear.
Yes, of course, Dr. Khalid. Thank you. Dr. Pranab.
Hi, thank you for the question. I always consider myself to be a social person, always hanging out with friends and participating in social events. But then, because of the COVID situation, I couldn't do that, and I was staying in isolation. Although I had my wife with me, last year I realized that I can do without active socialization, and I was able to enjoy time with my wife and my son. And so yeah, it's fun to be at home also. That is one thing I realized last year during the COVID situation. Thank you.
That's excellent. You learned you could be a home buddy as well.
Yeah, that's
true. Enjoy it. Excellent. Kim.
Well, I've learned patience, because usually we tend to want to go and do and get things and acquire. And during the pandemic, when you're at home, you just have to sit and wait and let things unfold. And for me, it was just waiting till unfolds and then respond, instead of going and requiring and doing things. So for me, patience was good. And I really enjoyed it. By the time I could wrap my brain around letting it come to me, it was good.
Excellent. We could all use a little bit of patience in our lives. Huh? How about you, Neda?
Well, for me, I think I learned how to live in the moment. Previously, I was a person that worried a lot about the future, but this situation taught me its future is not in my hands, so better to live in the moment. And also, I learned how to cook.
Ooh, you're in Bangkok too, so I might have to come over for dinner.
You're welcome.
Thank you, Neda. How about you, Shemine?
I was going to say exactly opposite of Pranab. I was always very internal, by myself kind of person, and I learned that I really need social activity. But actually, what I learned was that I've been trying so hard to fit into the expectations of my career path that I had suppressed a lot of my creativity. So this year, I really spent a lot of time doing more of the art-based creative approaches to being who I am as a holistic person.
Excellent. Well, thank you, speakers, and we're really excited to have you from all over the world here. One thing that I forgot to mention, we have 2 from Canada, 1 from Nepal, 1 from the Netherlands, and 1 from Thailand. So, welcome, welcome, welcome. And for those of you watching, just a quick rundown of how this panel is going to go. It's an hour and a half panel discussion. Each speaker will have 3 minutes to speak, maximum at a time, and then we'll move on to the next question. So that way, if all of a sudden one of the speakers is quiet or rushes through, that's because we do want to make sure all the speakers have time to speak, because they're so full of knowledge, and we're really excited to have them. So let's dive right in. And let's just start with probably the most broad question about COVID and depression. What has been your findings or your experiences in your fields with COVID and depression this last year? In a general sense, let's start there. I'll start with you, Kim.
Well, for me, I was very busy in the sense that I would see a few clients when it was possible, and loneliness was something that I saw how many people suffered from. And not just because they couldn't see people, because you can be in a room with 100 people and still feel lonely. So loneliness was something that I kept hearing over and over again, even though, because people are stuck in their thoughts at home and things like that. So feeling lonely, and issues would come up for people of how they feel lonely and why they feel lonely. I think a lot of us feel alone in the world, and we wonder, that's why we want this interaction, this connecting so much, because we think that will take away the deep loneliness we feel. So I was working a lot with people with that kind of issue, and that brings depression, because at some point when you're so alone, you start getting those feelings of sadness or even anxiety, because anxiety can bring as well depression at some point. So those are the 2 things that I've really noticed.
Thank you, Kim. How about you, Neda?
For me, I should agree with Kim first. And then I think an issue that I noticed for myself and the people around me was the problem with the self-expression. When we are in a situation of social environment, I think it's easier for us to express ourselves in any different ways. But this isolation, no matter if you were living with somebody or alone, I think we kind of limited a lot. It wasn't clear for us how we can express our emotions or our feelings and how to deal with it. I think that was one of the main things that I found problematic.
Yeah, thank you. And Shemine, I see you shaking your head. Yes, I'll go to you next.
Yeah, I agree. I think it's problematic. And I think that self-expression was also at times, at least with the students that I interact with mostly, they felt everyone was struggling. So they didn't have anything more to say, that what they were struggling with was no harder or no different than anyone else's. And so if they needed to step up and cope with what everyone was experiencing, but ultimately that experience was so different for each of them. So offering that space to express themselves, I think, became really critical. And I think I continuously hear this, and I'm sure many around the table continue to hear this. Well, everyone is struggling with isolation, so it's not really an issue. It's just what we have to live with. And that for me is a really big concern as we move through depression and COVID.
Yeah, and we're going to come back to isolation because that definitely is a fiber that we really want to talk about. Dr. Pranab and Dr. Khalid, I actually want to twist the question just slightly, just because of your profession. Same question, however, do you feel that depression has changed the way that it is and the way that it manifests and the way that it feels in any way? And I know this is a close-ended question, since COVID. And if so, what is that? And I'll go with you, Dr. Khalid.
It is very important question, and before I share my experience about this, we have to first of all differentiate between the fact that people feel sad, feel depressed, but not necessarily clinically depressed at any given time. Number one. Number two, when something hits us, whether it's a loss of investment or a beloved person failing a class or COVID pandemic, people go through stages, and one of them is the adjustment, where they feel also depressed and sad and angry maybe, and so on. So that can lead to the full-blown clinical depression, but depending on how people are willing to see it, to adjust, seek for help, they may just live the moment, try to deal with it, but not necessarily into the full-blown depression. That's just from one perspective. The other perspective, someone who's before COVID maybe had experienced clinical depression, whether during the pandemic, the depression symptom worsen, continue to be the same, or maybe, and which I've seen some of it, people were able to say, look, I have been depressed many years in the past and I've managed. It won't be any different, except that they have to be creative to live the isolation, as my colleagues has mentioned. And I would like to hear from Dr. Dahal as well.
Thank you.
Thank you, Dr. Khalid, and I completely agree with Dr. Khalid. And I think COVID actually changed the way we practice psychiatry for me personally, because we had to digress from the traditional practice of psychiatry, and we reverted to telemedicine after the onset of COVID, because the physical care of patients was not possible because of safety first, the agenda, and also because of the subsequent lockdowns. So patients couldn't travel from their homes. And so we had to shift to telemedicine. And that actually was quite challenging in the beginning, because coming from a resource-limited setting and a developing country like Nepal, a lot of people don't have the proper equipments for telemedicine. So that was a big hurdle for us in the practice of psychiatry. And as Dr. Khalid said, so COVID was a change in all of our lives, and it was quite sudden. especially the lockdown, and any kind of change will demand us to make adjustments in our lives. And people have their own routines and habits. So when they have to adjust to different circumstances or totally new environment, there's bound to be anxiety and depression. So the prevalence actually increased during this time. And the third point being, a lot of patients who had pre-existing conditions, they had difficulty coming back to the hospital for follow-up visits. And that's why they couldn't secure medications in time. So that actually led to a lot of exacerbation of illnesses. So overall, it was a very challenging time. And I think everyone had to cope with it. And I think we've grown over the last year. And that's about it. Thank you.
Thank you, Dr. Pranab. I'm actually going to throw it back at the two of you. Dr. Khalid, you had said that there's a difference between feeling depressed and actually being depressed. Could you give our audience maybe some differences between the two? And I'm also going to come back to you, Dr. Pranab, as well. Khalid.
Yeah, of course. So feeling depressed, anyone might feel it maybe daily or by the hour, once a week or a month, maybe related to situation, maybe out of the blue. But feeling or having a clinical depression, we're talking then about a set of symptoms, like clinical symptoms, starting with depressed mood, loss of interest, one of them at least, with other related or associated clinical changes, including sleep pattern changes, appetite, energy, concentration, motivation, guilt, excessive guilt feeling, and sense of worthlessness, and needless to say, feeling unsafe or suicidal. So when group of symptoms together with depressed mood and or loss of interest continues to be the case every day, most of the day, at least for 2 consecutive weeks, plus impairment, like you find that the person who is experiencing all these symptoms start to affect his or her daily routine, relationships, jobs, schooling for quite some time, there and then where we say, oh, this is a clinical depression, not just simply feeling sad or depressed that day or that week or that month. That is in a short month.
No, thank you. Dr. Pranab, do you have anything to add to that? So for listeners listening, they can maybe start to identify if they're clinically depressed or just feeling the depression.
So in diagnosing depression, we basically follow the WHO ICD-10 and 11 guidelines, International Classification of Disease. And as Dr. Khalid mentioned, the symptoms for someone to be diagnosed as having clinical depression, the symptoms should be persistent and pervasive. And the symptoms should last for a period of 2 weeks. And the primary symptoms being low mood, a loss of interest, or reduced energy. These are the main 3 symptoms. And if any 2 are present along with the additional symptoms, then we should think about the patient having clinical depression. Whereas feeling depression is something different. We all do feel depressed from time to time, like for half an hour, or but it shouldn't be pervasive and persistent throughout a period of 2 weeks. If that is present, then we should think of clinical depression. That is the difference, I feel. Thank you.
Well, thank you. Kim, I'd like to come to you because with your regression work that you do, how have you helped your clients really pinpoint what they're going through and work through what they're going through when it comes to depression?
Well, I look for thoughts that are repeated. Most of our thoughts we have a day are in repetition, and especially negative ones. We tend to think more negatively about ourselves than positive. So those thoughts repeat themselves a lot. Through the years I've been working with this, I've noticed that there's certain sentences and specific emotions that you repeat constantly in yourself. So what I do in my sessions is that I look for those repetitions. I look for it either in current memories, where you would say things, I feel alone, I feel powerless, I'm not good enough, all those really sentences. Or I go to past lives and I look again for those, even though the scenario or the scene is maybe different, the thoughts will be the same. So I look over and over through the sessions, what is the repetition that you're feeling and thinking? And at some point you can really map it. So there's usually one core belief, like one thought, like I'm powerless, but we can have 100 people who are powerless in a room. So I look specifically, how do you feel powerless? And the story around your powerlessness, because I think we tend to forget that we're very unique individuals, different cultures, different backgrounds, different upbringings. So who you are and the way you think is really unique to you. So I really map out what is unique to you, the way you think about yourself. So if it's depression and you're very sad, you know, sad is not enough. How are you sad? What kind of sad, you know? What makes you sad? When are you triggered into sadness? And once I find that particular belief system, that's when I help people try to change it gradually.
Thank you. Shemine, I'm going to come to you. I know you're currently teaching, or you were, I'm not sure if the semester is up, but you're teaching a mental health course for child and youth care practitioners. What's been the discussion in your class around COVID and depression? And yeah, what are some of the things that have come up?
Yeah, I will say that I taught it in September, so it was last semester, and it was still very new for a lot of students. And so it was still a very new processing. And so we didn't necessarily talk about the actual implications of COVID, the pandemic on people and children and youth directly. We spent a lot of time understanding how it was impacting ourselves and the self, because as practitioners, I think we also at some point have to normalize that we go through these experiences as well, and we don't sit outside of it. So similarly to what Kim was saying, actually, is we spent a little bit of time trying to understand what the core or the root concerns are for the children, youth, families that we work with. And then we look for those exceptionalities to them. We look for those things that just sit outside of that normalized narrative. So perhaps someone is talking about always being sad, but then the minute that they ran to the park, they were really happy. So how do we spend more time in that really happy moment to kind of build on that strength-based approach? So we spent a lot of time unpacking that kind of scenario. And then in my own practice, I spend a lot of time doing the same, is this idea of how does this look and feel different than it did perhaps a year ago? And what symptoms or experiences would you have had at that time? And now what are you having? Is there a parallel? Is there a disconnect? And then can we sit in that kind of in-between space to find some exceptionalities?
Thank you, Shemine.
Yeah.
And I'm going to go over to you, Neda. I know that you've created a therapeutic writing course and you use this a lot with your clients. How have you seen that course help individuals who might be either feeling depressed or clinically depressed?
Well, I don't call it therapeutic writing because I'm not expert in the field. I mostly call it like through expressive writing. For me, let me give you an example for the last course that I had with teachers that are working in Thailand. I had a course that I used journaling for success. And through this course, the teachers had to go through creating stories or some part of art and express themselves. So it was the first step because I wanted to know what is the measure. And I realized that many of the teachers that they are living in Thailand, they are very stressed, not just because of their job, but because and the COVID situation, but also because of the difference in cultural aspects. They didn't know how to handle it, and stress that comes with a lot of things in the schools. So with that, I changed the type of the journal because it's a creative based. I created it depends on the way that they could express themselves without feeling of judgment. I used this idea from the Japanese philosophy. I don't know if you've heard about Wasi Sabi. Wabi Sabi, and this philosophy actually is talking about imperfection, impermanence. It's something very intimate and personal, and I think this helps. This helped me as a person to manage this type of situation. And my course was that I let them to express themselves without the feeling of being judged, because I think mostly the depression that comes with the situation, like overwhelming situation such as COVID, it's very, for us, normally we feel the tension of talking about it. So to sharing or what other people would think about us. That's why this type of course that I create, it doesn't have to be shared with anybody, even me. So they have to, they can share it either by words or any type of art, kind of like art journaling or junk journaling. And through that, they can either throw it away, or they can doodle over it. They can share it if they want, or they can just paint over it and start a new page. This is how I try to use creativity to remove the tension, physical or mental tension that they are coming with this type of distress.
Excellent. It sounds like you're giving them a safe space in order to be able to use their voice in a creative way. And I see Dr. Khalid over there shaking his head. I want to throw it back to you. And how important is it to have a safe space, especially because we know that COVID has changed the dynamics, period. We're in more isolation. The world is unknown right now, period. A lot of people are in scarcity mindset, which we'll get a little bit into mindset as well with the depression. But yeah, how important is it to have that safe space? And what are some things that people can do to create that safe space even during isolation?
I believe you said me.
Yes.
Okay, sure. Working with children and adolescents, always that is in the back of our minds, that youth in particular, adolescent and youth, they would always look for safe space to express themselves. So this is one. But then even before COVID, that's before COVID. But then with COVID, using virtual means, how safe the youth will feel that I am not being spied on or something like maybe leaking out of that system. So we had to be, not just us in my hospital where I practice, but everywhere, I guess, people were looking for safe platforms to ensure confidentiality and let people express themselves as they used to do it behind closed walls in the actual hospital centers of community and so on. So I definitely agree with that. And again, back to the children and adolescent, they might not feel willing, they may not have the willingness to share their feelings unless they trust the person in front of them, be it their family, friends, needless to say, the experts. So we have to be creative in a way to welcome them, to set a safe environment, and to be quite open, non-judgmental. And these are all contributing to the fact that they will feel more comfortable opening up to you and disclose what is bothering them. So that's my contribution to this question.
Thank you, Dr. Khalid. I want to bring it over to you, Shemine, because I know that you work closely with the youth. And actually, I saw a note pop up in the chat, but I can't read it. So I'd like you to add to that question because, to the answer, because you do work so closely with the youth.
Yeah, when we work from a child and youth care perspective, we work in what might be called lived spaces. So we're either in the child's family home or we're in group home settings with the young people. We're less in the actual, I don't know how to language this, but like that clinical space. They're not coming to the hospital to see us. They're not coming to a counseling office. We're actually going to them and living with them. And the one thing I think also is that in and of itself creates some of the safety to it, is that we're in spaces that they hopefully feel most comfortable in. And by them welcoming us into their space at a pace that works for them, it also opens up opportunity for them to be creative and be expressive in ways that matter. What I was writing in the chat was actually, I think we focus a lot on children and youth, but I also think, well, I focus a lot on children and youth. I also think when working with adults that there's this inner child that we all want to connect with, and that times like the pandemic and times like sadness bring an opportunity to connect to that inner child and really go back and say what was needed, what does that little person, so what does the mini Shemine really need from Dr. Shemine, and you know, and having that conversation in whatever way fits. And I think that goes back to what Neda was saying about the creative ways of expressing, and we don't know oftentimes what comes up during those creative expressions, and sometimes they just present themselves. And I'm curious about more and more through this pandemic, how much of those unknown drawings or unknown words are part of our inner child trying to escape in a space that maybe is now allowing it. I haven't done too much research around this, but I do believe that children are innately aware of what's right and wrong. I mentioned that yesterday briefly. I believe children understand how to navigate and negotiate spaces because they haven't been taught out of that yet, that their bodies just walk in and have a sense of if something feels good or not. And I think that creative expressions and working with children and youth has allowed me to do that with adults as well, to go back to that innate presentation of who they are and who they desire to be.
Yeah, thank you, Shemine. And Kim, I'm actually going to come over to you. I know this is your field. I mean, you help adults go back to their inner child, air quotes, and other parts of their life. So please add to this topic.
Yeah, when I use the inner child, usually it's around when someone has a lot of trauma in their childhood. So you can pinpoint a moment where that particular trauma or experience that they can't let go, still in their adulthood, we come back to that moment. And when you go back to that memory, I really take my time to see the whole room in your mind's eye. Who's there, what you're feeling, what you're thinking. And I'm really precise when I talk about emotions, because a lot of the time when I say to somebody, how do you feel in this moment? Oh, they'll just say, I feel terrible. Well, terrible is not an emotion. I help people to really be specific in the emotions they're feeling and their thoughts. And when you get to the child, it's funny because when they see them in their mind's eye, right away they want to hold them, nurture them, talk to them, and they can feel in the child as they're looking at it changes. This child smiles, or it tries to hold you more. So you can see right away there's a healing that appears, and the client can feel it because they're actually talking to themselves, and they can see it in their mind's eye, the child changing into an aspect that's not sad, but more happy or more nurtured or more safe. So that's what's interesting, because when you feel the change, and this is what I find really interesting, is that when you're having and holding the child, and I've done this myself when I started my work, I went to my own inner child, and I remember just holding it and thinking, what would you like? And I said, oh, I want some balloons. And I remember just grabbing balloons and giving it to the inner child, and the smile came and the calmness came. And I can also felt the calmness in my own self. So when you heal that moment and all the emotions come out during the inner child session, they feel the resolve because it's felt. They really feel that I can let it go now, and it's easier to discuss what's going on with me because I looked and I nurtured that part of myself.
Thank you, Kim. Absolutely great work. Neda, I want to bring it over to you. I saw you shaking your head, and something that Kim said was she's really specific about the words, the language around the emotions. And with you being a writer and just a soulful person when it comes to writing, how is it important to really explore the right words, because we tend to stay in the same kind of same grouping of words unless we're kind of pushed out of that comfort zone, and what have been your successes with helping people explore that?
For me, I think writing is easier for people to self-express. For me, myself, when I started writing, my genre was totally different. And then was suffering from depression for a very long time without knowing it. And until I had the breakdown, and that was the time that I thought I have to do something. So I explored and I just write down and express whatever I felt without the fear of sharing with anybody, without the fear of it should be perfect or if anybody would judge me about my writing. And through there, I found all these pages that I was writing and writing since very young. And I realized that was the place, the friend I had among all other people that listened to me without being judged. So I think writing gives a powerful tool to the person that is writing down the words that is like empathic listener. Without judging you, it just have that empathy in them, that they understand how you feel. Without listening to you, without judging you, holding your hand, telling you everything will be okay, you know. So I think writing for me personally and for the people that I work with help a lot. At the beginning, everybody is a little bit cynical about it, if it works, if it not. But after a while, they realize how powerful is the words, how they can express it freely without really fear of anything. So I think this method worked because I mixed the Japanese philosophy with the transgressive writing. And actually, it's working properly, very well.
Good. Thank you, Neda. Creativity, there's a lot of chat. I can keep seeing creativity and inner child pop up in the chat. So definitely a lot of people agree with that point, those points. Dr. Pranab, I'd like to bring it back over to you. You had spoke about shifting to telemedicine. So I'd like to ask, especially for those practitioners in the audience, you know, what are some things that you did to create a safe space to have them feel more ease with that switch with your clients? Dr. Pranab?
Thank you, Lynn. So as I mentioned earlier, I work in resource limited settings, and then not all of my patients have internet access at home, and a lot of them also don't have computers. So in order to cater and provide care to them and continue the care that we had been providing to them, we actually set up a clinic in an urban setting in close to the hospital, where they could come and access the computer and the internet, and we provided them care via the internet. And so it was quite challenging because we had to hire people to maintain the proper sanitary, sanitization of the room where the patients came to seek help. So after every patient, we had to sanitize the infrastructure completely, and so that was a big challenge. But then, so one good thing that came out of telemedicine was that the follow-up rate actually increased. A lot of patients, who had difficulty because of the lockdown, they had difficulty coming to the hospital, and also because of the fear of coming to the hospital, they were more comfortable in coming to the one-room clinic in the city center, where they could come and access care and seek care from the practitioners. So that is how we had to adjust to the situation.
Wow, that's incredible. Just to add to that, how with them, how did you verbally or energetically even help them feel at ease? Because yes, they got there, but also not seeing, somebody face to face, and also I would assume those keeping the one room sanitized probably were in their suits and all of that. So did you do anything different to help bring your clients at ease since it was over the internet? And if so, what did you do?
So we also have a support group for COVID, and so we have volunteering to provide information about the mental health changes that can happen during the difficult times. And so the volunteers actually provided care to the patients, and They also provided their phone numbers. So if they ever felt more, anxious or having negative thought processes, they could reach out and call the hotline and seek help from the volunteers. So we had to we also introduced that in our practice because of the COVID situation. So that is what we did, and of course we couldn't, although we wanted to, we couldn't completely. So because of the modality of care, we couldn't.
Oh, thank you, Pranab. Your time is up. We'll come back to you. I appreciate that. Dr. Khalid, I'd like to bring it over to you. What are some signs? You had mentioned earlier some of the signs. Let me ask that question again. What are some things that lead, besides COVID and the isolation, what are some other things that lead to people in depression, lead them into depression?
Very good question. But I was hoping if I have maybe less than half a minute, just in follow up to the last question, how we put patient at ease through virtual means. It is funny to see that in the past, when they used to come to, at least in where I practiced in the office, in the hospital, they will be dressed like formally coming to my office. And what they see is the way of interaction. So they may comment on my certificates, my toys, my office. But interestingly, when now we're seeing them through Zoom or through virtual means, actually, and I'm dealing mostly with the adolescent, I start commenting on their background. Like mostly I see them in their bedrooms, sometimes their animals come, their cat, their dogs. And it was so interesting to initiate a conversation and put everyone at ease. So that's quickly on that thing. I think I have 2 minutes maybe or less for the following up question. But anyway, what other things beside COVID? I would say it starts with the cognition, the thinking. Some of us humans are more geared toward negative thinking versus others. This group of people will be at a high risk to experience the clinical depression than the others. We all, through COVID together, we all go through the uncertainty, the fear, and so on. But some of us will be more resilient to see the light at the end of the tunnel. Some of us may not be able to see it. This is one factor. Second, how much support do we have? Yes, we were forced to be in isolation, but that doesn't mean we're disconnected from the rest of the world. Some of us elect to disconnect themselves even through virtual means, but some manages to continue the relationship with others. Then the third point, which in line with the first one, how willing to open up, of course, in a safe with someone who you can trust, to open up how you feel and let it off your chest. That might also help not to lead into a clinical depression. And as I said earlier, for some of us before COVID and what may continue after COVID to have the predisposition for depression, be it biological, genetical predisposition, or like a metabolic or immune system related. This is another topic if we have time, we can talk about it.
Okay, we'll definitely come back to that. Thank you. Shemine, I want to come to you. I got to hear you speak yesterday and you talked about volunteerism in sports. And I wanted to ask you, how do you feel that volunteerism in sports and recreation can really help someone that might be going through depression?
Mm-hmm. I think it's a huge question. I can see Kim smirking a little bit there. And I think for me, the first thing is connection. So connection to self, connection to other than human, which is the definition Sheridan provides in 2008 around spirituality. So I think that volunteerism, sport, recreation allows for connection. I think the other thing too is from a sensory motor perspective, it allows our bodies to move, our muscles to move. And I sometimes believe that some of the experiences and the feelings we have sit within our muscles. And so when And so when we're utilizing our muscles in positive and beneficial ways, we're able to move the energy through them. And in that sense, Dr. Khalid and Dr. Pranab could probably speak about the biology behind it, but we're releasing different endorphins and hormones. And I think that that's what allows some of these feelings to get processed and to move around in our bodies as well. And I think the same comes through. And when I define recreation, I used to use a very Eurocentric perspective of a freely chosen sport or activity. Now working with young people and trying to understand it, that's where volunteerism came up, where they define that as their form of recreation, their freely chosen activity that brings a joy and a light to them. So some of them would say things like, I use volunteerism, or I use tutoring, in fact, to spark a joy and light my own soul, is one quote that I have from my research. And I think that that becomes really powerful because they're doing something meaningful. They're making meaning. They're translating their own learning journeys into something that's helping another person. And that became really clear. I don't know if that fully answers your question, but ultimately, I think recreation offers a space for people to make meaning of and make sense of experiences, and to move the muscles and the bodies where our stories and energies are held. And I would connect that to Neda's work around writing too, right? The muscle of actually handwriting versus typing will potentially result in different expressions of feelings and thoughts.
Absolutely. And yes, absolutely it does. And another big thing that you said is about feeling that sense of connection, which is huge. Connecting to self, connecting to others, connecting to our bodies. And so, Kim, I am going to throw it over to you because I did definitely see you shaking your head as well. So please add to that.
Well, the one thing I want to mention before I get to the body is that in my work, I've noticed that we speak from two places, because I use a meditative trance state when I work with my clients. Now, even though you're in trance, for a lot of people who don't understand that, you're still here, you're still present, you can get up, you can walk around. It's just that you're focusing more on this inner communication of what we call the higher self or the inner self. So when I work with people, a lot of thoughts come from our head, but there's a lot of information that has to come through the heart, because the heart and the head do speak different. So when I work with people and they're in this trance state and we go to whatever memory or past life issue, which they're feeling sadness or depression about, you'd be surprised how much memory the body has. Sometimes even the body may twitch, their hand may twitch or something, and I'll go, hand, what's going on? And memories are caught in that because whatever happened in the event that they're observing, their body was present obviously in that moment. And therefore there's a memory in certain areas of the body. And if I ask the body what it needs to say, they will have an intuitive answer that will come to them that will explain certain things. So I had a client who had maybe pain in their stomach. And then when we go back and I say, stomach, what do you want to tell the particular person? They get a memory or they get the sentences that communicates to them, because this inner information that we have is a treasure trove of information. And sometimes we get too stuck in our analytical thinking or our rational thinking, and we miss a lot of who we really are, because our identity, and I think a lot of people during COVID and depression really got hurt because their identity was hurt. If you're losing your job or you're losing your business or your family is far away, then who are you? And there is a bigger question, who am I? So when you go into the higher identity or the greater identity, people would be surprised how much information comes up. A lot of us have talked about creativity. Now, the more people are creative, dancing, singing, writing, coloring, as soon as you stop thinking, you start relaxing. And that's the first thing I've noticed when I work with clients, what the inner self tells all the time. Almost every client, you need to relax. But how do you relax? Because each person has their way to relax. So what they do is that take a walk, draw, listen to music, as long as you don't think and you're not stuck in this repetition constantly, where you get a break. And that's really important to identify in ourselves and find creative spaces, whatever they may be, or sports. Either way would be good.
Absolutely. Thank you. And I'm going to come to you, Neda, but it's funny when you say that, I think of all of our good ideas, my good ideas come to me when I'm driving in the car, when I'm in a space where I'm in like just a kind of a meditative space almost. Or people say that their ideas come to them in the shower or brushing their teeth because they're doing something that's repetitive and they're not having to think. So they're out of their mind and more into that inner self. Neda, I'd love for you to add to this because I saw you definitely agreeing and shaking your head as well.
Yeah, actually, I was thinking about this repetition, and Kim mentioned that. I also agree with Shemine that mentioned about physical activity. This is true that when you do some activity, creativity, I don't know, physical activity like a sport, it helps you to stop thinking. I think this repetition is something alarming. It's not something we should forget about it. And it's, Kim previously mentioned about repetitive behaviors that she noticed in her clients. And I think this is something most of us, we just don't notice it. During COVID or previously, there are many of us that are falling to the loophole of wake up, do some work, some chores, go home, cook, eat, binge watching internet, waste time, and go to bed, the next morning repeat again. This repetition is really alarming. And even before COVID, I noticed that it dragged many people into this feeling of apathy, that they don't really have motivation, they don't have any goal, they don't really enjoy what they are doing. And many of the jobs these days, apart from the situation that we have in COVID, I think the office job doesn't give you that feeling of fulfillment that all of us want to have. And I think through some kind of activity like creativity, it's a personal thing, we feel that instant feeling of happiness, that we fulfill something. If somebody is writing a piece of a paper, one page, whatever they are writing, when they finish in some way without thinking of any result of this, it gives them that feeling of fulfillment. The creativity, for example, when you start drawing something, when you draw and you finish, you feel like you finished something. This gives you that feeling of fulfillment. That is why I think how we spend our free time, because most of us, we might not have that much free time. Many of us, we found more free time during COVID, but how we use that free time is very important. How we are not wasting our time on something, for example, watching YouTube or looking at Instagram. We see that many people are successful in their way, the way that we want, but are we doing something with it except that we are wasting time?
Yeah, thank you. Yeah, a lot of people are feeling stuck and wasting time and just in that weird kind of hamster wheel right now. I'm going to throw it over to you, Dr. Pranab. How do you help? Have your clients experienced that, where they're just feeling in this kind of almost Groundhog Day in the last year and a half, that everything just keeps repeating itself? And if so, how have you helped them transition out of that to feel more motivated, to feel more focused, to feel more hopeful?
So yeah, COVID was something new. So for a lot of patients, for a lot of individuals who had depression and anxiety for the first time, they had difficulty identifying their symptoms to begin with. So they didn't really clearly know what they were having. So it was very difficult for people who had already had symptoms from the prior to COVID. It was much easier for them to express their feelings. For those who were new, the symptoms were new. It was very difficult for them, and so they usually were not able to vocalize their feelings. And in our society, a lot of patients, a lot of individuals are not really vocal about their mental health. So I personally, after the family members come in contact with me saying so, and my son or my daughter is having such and such feelings, I usually ask the family member to ask the patient to write down, and patients, when they write down and use their creativity more, they become more expressive. So that is one way I use in encouraging my patients to be more vocal about their feelings. And So besides that, there's a lot of content in social media regarding how COVID has affected mental health. So when they are free at home, they can actually, instead of watching movies or just entertainment shows, they can actually make use of those mental health awareness and advocacy programs and websites to learn about their symptoms more. So that is what I do in my clinical practice. Thank you.
Thank you, Dr. Pranab. If you have any of those resources, please put them in the chat. If not, no big deal.
Sure.
Yeah. Dr. Khalid, I want to bring it over to you. You had mentioned earlier about negativity, how that plays a part in the negative mind, if I remember correctly. And so I wanted to bring it back to you about the fear that a lot of people felt this last year, that uncertainty, and maybe how you've helped your clients, or some things that maybe some of our listeners can do to help transition themselves into more of a positive mindset and more of an abundance mindset.
All right, and I would like also to connect this point with a point mentioned earlier, and maybe to have a comprehensive view of how to handle or how to deal with depression, anxiety, and in general, all our clinical problems or medical problems. The exercise, when they talked about the exercise. So I would like to take this opportunity to say that it's not one or the other. It's usually many factors, but some of them might be more obvious than others. For example, in someone who are clinically depressed because of biological predisposition, doesn't mean that it is only because of that gene they become depressed. Because you might have in the same family, coming from two siblings, one of them will be more prone to develop clinical depression, the other one may not necessarily do so. So how is that different between the two? Maybe it is the way of thinking, and that brings us to the negativity and the uncertainty. So if you allow yourself to think about situation in a pure negative way, then you are more prone to fall or indulge into a clinical depression. But if you are more realistic, more willing to see the positive side of it, then you are more capable to overcome the depressed mood and hopefully not to go into the full-blown clinical depression. And one of the main tools that we use in clinical practice, it's a powerful tool that was developed by Aaron Beck in the 70s, which was the basis of what we call it nowadays, or everyone is aware of, the cognitive behavioral therapy. What he looked into his depressed people, the patient at that time, 70% they were responding to medication, but still 30% of them, no matter what medication they were offered, they're still depressed. So he started thinking about something else beyond the biology. So he, just to cut it short, he came to the conclusion that there are some distortion in our way of thinking. One of them is the negativism. So we need to work and help our client to work along these lines and bring them back to realistic stage, at least, if not more positive as well. I hope I answered that point.
Oh, absolutely. So I do want to roll it over to the ladies and ask, what are some holistic ways? And we kind of just dipped our toe slightly. A couple of you had mentioned the spirituality fiber when it comes to depression. So what are some holistic ways that individuals can help cope with having depression or feeling depressed, regardless if it's during COVID or not, because depression is going to be here long after COVID is gone, hopefully. So Shemine, I'm going to come to you first.
Awesome. I think that there are a plethora of ways that people can work through and sit with their experiences of depression. I feel like I'm kind of reiterating, but I really think movement. I think movement is a really powerful thing. I think finding multiple practitioners that you turn to, and I really say multiple and the right fit, because I don't think that the one practitioner fits all needs, or one practitioner can weather everything for many years with you. I think that it's okay to say at this point, I need someone with a different perspective. And I really want to iterate that, you know, it has to be a fit for the person and not necessarily a fit for the practitioner, right? And so that's one. I think that creating social support systems is a really important thing, whether that be virtual, in person. I think that we've learned that through COVID, is that having those networks. I think doing work in lived spaces is really important, and that's what drew me to child and youth care. I think that being in community is a really powerful way of us working together. I think that there is I want to go back to that idea of spirituality a little bit and that connection to self. And I really do believe that there is a disconnect with self. We don't necessarily understand what it means when our toes tingle or when our feet start to sweat or our hands start to sweat. And I think really spending time and understanding that somatic part of ourselves, that the responses that our bodies offer, and Kim talked about this a bit, I think that that's a really important component to working through it, so that when we start to notice the butterflies in our stomach, what does that even mean? What does it think? We use that phrase so often, but do we actually know what it is and what it feels like for each of us individually? We can pause in that moment and really say, okay, what is this message telling me? And I'll give you a very quick example. When I was younger, every time I would see somebody in pain, physical pain, like using crutches or something, my stomach would start to feel like someone was taking it and like curling it up into a ball. And I never understood that until I did some of the somatic work. And now when that happens, I understand that something around me, someone, nature even, is in pain to a certain degree, but that comes with that really deep work. And so I think that that's a really powerful way to go about it. But again, a plethora of ways. So I think, you know, each of us will have different ways of approaching that holistic self.
Absolutely. Thank you. Kim, I saw you definitely shaking your head. And I'd like to add to that is maybe even a couple of tips of how an individual can do it on their own. And I definitely agree with you, Shemine. It should be the right fit for the client and for the practitioner, not just for the practitioner, and having multiple sources, the multiple outlets. So, but Kim, over to you.
Well, when I work with my clients, here in the Netherlands, psychedelics are legal. And when I mean psychedelics, it's magic truffles. And I work with those with clients who either suffer from depression or anxiety. So what you do is you get a very small dose, a bit like homeopathic, and you don't feel it. It's non-addictive. And what it does in your brain is amazing, because if people are really, really depressed and they just can't get out of the cycle of thinking, what happens is that when you take the magic truffles, which has psilocybin, it really connects to, it basically binds to your serotonin receptors and stimulates them. And your whole brain lights up. So there's areas of your brain that you're using, and the default mode network basically shuts down because there's less blood flow. So what people are telling me when they use this microdosing is that they feel like there's space. Instead of being stuck in the negative thinking, they can rationally say, well, let's go now, that's enough, stand up, go for a walk. Whereas before they couldn't even move, they couldn't get out of bed. And now they had a bit more space in their thinking to do other things. So this is why I use that a lot here, because it gives you a break basically, and you get a sense of calmness. So your anxiety, if you suffer from anxiety as well, you feel a bit more calm, where you're not plagued every day, all day with anxiety. So that's another way we should look at treatments also. The people feel so empowered in that because they have something where they can take and function in their everyday lives. Here in Holland, medication, a lot of people see it as taboo. And personally, I think sometimes we over-medicate. Here, sometimes you can just go to your regular house doctor and get antidepressants, where I think sometimes nature has its way of healing us without us knowing that we can use things where we don't even feel, and it really changed our thinking. And I think that is something that we need to look more into to help more people in a more holistic way, definitely.
Thank you. And Neda, earlier you had spoken about using presence and being in the present moment, which is a huge part of my spirituality practice. I'd love for you to talk a little bit more about that and how that could help individuals in this circumstance.
Is it
I
for
would
me?
like to mention that
Neda.
I do agree with Kim and Dr. Khalid mentioned before that sometimes it's physical issue like a neurological transmission blockage that is out of the control of people like us to motivate somebody to not be depressed. So that needs medication or herbal treatments or any other tools. But I do like to add to Shemine list because she perfectly, I think, covered everything I had in mind. Well, I do agree with physical activity. It helps a lot. And I think it goes under the body, caring for your body, mind, and spirit. And I think living in the present goes under the mind and spirit. And it can actually be, for me, the best advice is to, it's so hard to say it, but not thinking about the future. Because when something is out of your control, and you really don't have any power to control it, to change the situation, it's better to accept. And this acceptance is not a simple thing. It's very easy when I say it, but it's not really manageable by a person without any help if it's in that level. But most of us can manage it if we just know how to avoid these negative messages that are coming toward us, because it's not always us thinking about negative things, but it's the media covering our life with all this negativity. It is, I think, the purpose of the black advertisement. This is what they call it, I think. So I think one of the things that helps you to live in the moment is to avoid using internet so much, to be honest. I do agree with one of our speakers that mentioned internet can help, but in another way, I think the news that we have on there and all these negative feelings and the negative information coming to us, it gives us the mentality that whole world is in a disaster, is a mess. So what can we do? We just become more negative. We fall into negative mental behavior, such as binge eating or just not doing any activity, having no motivation. So that's what I think. Living in the moment would help if we don't have this negative income from the outside, and we can actually control that.
Yeah, thank you. Dr. Pranab, in your bio, you had mentioned Buddhism, so I want to bring it over to you. What role does your spirituality practice, what role could that help? How could that help your patients or people suffering from depression? Dr. Pranab.
So yeah, thank you, Lynn. So how I use my spiritual practice in the practice of psychiatry is that I often am an advocate of mindfulness-based meditation. So from my experience, I have recommended patients use mindfulness-based meditation, and it works very well for mild depression. I can't say about severe depression, which requires admission to the hospital, but mindfulness, especially if it's combined with
I can't turn this.
Especially if mindfulness based meditation is combined with CBT, I think it comes to it's very beneficial for the patients, and I often recommend mindfulness based practice to my patients with depression and anxiety disorders.
And what's the result that you've seen when they do practice that?
So we see improvement in the symptoms of depression and anxiety, and although the improvement may take a bit longer than when we use antidepressants, but the benefits are definitely there. And from my experience, once patients start practicing, they eventually go on to practice for a long period of time, and the recurrence rate and relapse is also very less in patients who practice mindfulness-based meditation. Patients who had depression in the past, if they do practice meditation, then their chances of relapse back into depression is also very less, and studies have also shown the same.
Okay, thank you. And Dr. Khalid, I saw you nodding your head as well. Do you have anything to add about the spirituality practice, mindfulness, or a holistic approach to helping individuals work through their depression, honor their depression, and heal from their depression?
Yes, thank you, Lynn. And I've put something in the chat because I don't want to be to leave this panel today without emphasizing that no matter what illness do we have, whether it's diabetes, hypertension, all sort of mental health, the best approach to treatment is the holistic approach. And I even tell my clients, my patient, when they come with depression, it's not just the depression that we need to do biopsychosocial, even the diabetes. If I'm giving you the best insulin or oral hypoglycemic, but you're not working with the dietitian, you're not exercising, you're not having good sleep at night, then your sugar level may not be corrected as you wish. Same thing applies to mental health, including clinical depression. So even if we know that this family depression runs quite high through generations, still we need to work through medication. This is number one, important. However, equally, if not sometime important, to go to work through holistic approach, depending on what's their preferences. Can be spiritual means, can be exercise, can be cognitive therapy, can be all of the above. So it's just the importance of the biopsychosocial model, if I may call it that way.
Oh, thank you. Definitely. I can say from personal experience, homeopathy has helped me with my own struggle with depression. So holistic is just as hopefully just as acceptable as the medical side. So Shemine, I want to come to you, and what would be your advice for someone who maybe believes that their child or their loved one might be depressed? What would be your advice to them?
Oh, that's a hard one. I don't like to give advices. I think the first thing I would ask is I would engage in a conversation around what are they noticing that's changed, or what are they noticing that's concerning to them, and then seeking out kind of what was of interest prior to them noticing some of these things. So really going back down to it, I think that there is a huge benefit in this idea of family work, so that person, as Dr. Khalid was mentioning, like it is potentially the biological piece, but that no healing happens in isolation either. And so how do I bring the whole family into the context, what is going on as a unit, and seeking out support in that way, so that that person doesn't feel, that young child doesn't feel like they're alone in this process or alone in this journey, or that they've done something to harm their family unit. And I think that becomes really, really important. I also think if I was to have a parent reach out, which is often the case, I start to say, what's going on in your own body? Is your child maybe mimicking kind of what's happening for you? And do we need to do some work on that level as well? So this idea of if a person is just thinking about the question, if a person is seeking advice for a child or an adolescent, the first step I would ask is what's happening in the family unit, and then really thinking about, do we need to seek out medical advice and really think about what's happening on that biological, because I think what is happening as medical advancements are happening is that we're noticing things from a medical side that then can be supplemented by the psychosocial, and or vice versa. We might work psychosocial and realize that's not filling the bucket and need to go to the medical side. Yeah, so thinking about the holistic family and asking questions there. And I would say, lastly, never hesitate to reach out for help. And I think that that's the biggest one, is creating those open spaces that people feel confident and comfortable enough to come in and access supports. And I think really on a surface level is creating those spaces and creating those opportunities to access support.
Thank you, Shemine. I'm going to change the question just a little bit and pass it over to you, Kim, because you do such deep work with your clients going backward, how do you guide them to create a support structure that understands enough of what they're going through, but that way when they're out of the sessions with you, that they have that support around them, who can honor what's happening with them?
Well, I also believe, like Pranab talked about, meditation. I think that's a key component that our society doesn't use enough to silence the mind and to go into the inner self. Now, I teach my clients how to meditate. You know, there's different methods and different things that you can observe in meditation. So what I make sure is that they learn to relax their mind and their thoughts. And sometimes in the beginning, they fall asleep because they're so tired. So as they learn to silence the mind, I let them go into the inner self and have an inner conversation with their higher self so that they can find answers within. And I think that's what my clients like a lot working with me, is because they feel their own empowerment in finding their own answers about their own issues. I just ask a lot of questions about all kinds of things, and then they find their inner questions. We're not taught at school, unfortunately, how to meditate and how to calm ourselves and how to self-reflect. We teach everything else in school except that, and I think that would be a great thing. So when they go home, they practice these things as meditation, or go for a walk, anything that clears the mind so that they can practice themselves and empower themselves. Because that's really the point, is to get yourself empowered with yourself and knowing who you are. So you got to learn to go inwards. And I can't emphasize that enough, how much you find answers in that space.
Okay, thank you. And Neda, I'd like to come to you. I mean, obviously your writing, your creativity helps people go inward. And you had mentioned earlier the start of the COVID-19, you helped work with some teachers that were just in the uncertain space. What was maybe some of the guidance that you gave them to not feel so isolated and to really still keep that connection either with themselves or with others, to stay grounded in that?
I think what I tried to do was not teaching them, to be honest. I was trying to act as a mentor, because some of them are couples, some of them are living with other friends, or you know, they have connection, but many of them are feeling very lonely here because they are new to Thailand and they just came to Thailand, and this COVID situation all started. So they felt kind of in a very distressed situation, and they didn't know how to do it. They didn't have a friend here. They couldn't get out to club bars to find some people, meetups. And then all of a sudden they have to study. Meantime, they don't know how to manage their loneliness. The feeling of loneliness is one of the main things I think most of the people feel depressed. And for this, I try to be a mentor. And I mentioned earlier to be the empathic listener. I think all of us in a way are that empathic listener for somebody that we try to help them. And through that, I help them to trust me as a person, to open up in any way they want. And also, I always tell them, thanks to technology, we are, at least we can connect with each other. So try to get online with family, with friends. Find if you don't have somebody, because some of them unfortunately might be really alone. So you can get online and find a community. There are a lot of online courses, even for free. They are live streams that they are created for this type of situations. I think one of our presenter mentioned that they are creating this safe place online for their clients, and I think that could really help. I think that is the only thing I can mention about.
No, thank you. I can't believe it. We're almost to an end. We have 10 minutes left. I'd like to really hear maybe some closing thoughts. I feel like this was such a broad topic and we could have went so many different ways. And I know there's lots of unsaid things. So I'd like to go around the room really quickly and maybe give about a minute and a half to just kind of give some final thoughts, maybe a message to those out there who are needing to hear something to give them hope, or because COVID, we don't know when it's going to go. We don't know what's happening next. We're still living in that uncertainty. So who would like to start with a final message to our audience? Kim?
Well, I would say don't give up and find your tribe, finding people who are the close to you, who you can really open up to. And what I mean open up to is really talk about your feelings and your thoughts. And, even if they're outrageous or crazy, because sometimes people don't want to talk. They feel it's crazy or they're afraid to be vulnerable. I hear that a lot. Well, what I've learned through consciousness is that when you open up and are vulnerable and you're authentic in your feelings, consciousness breaks back back at you, someone who is willing to listen, who will give you the support that you need, or will help you find someone that you need. You just have to reach out and find someone that works for you, or any way that works for you. Because as soon as you start taking that first step, the second step comes, and the third step, and everything else becomes easier. So don't give up, and just find your tribe and the people who can help you.
Thank you, Kim. How about you, Pranab?
So yeah, talking about depression and COVID, I can't help think of the stressor. So over here, the COVID is the secondary stressor. And even within COVID, there has to be another primary stressor, which is leading to depression. For some people, it's probably the loss of a job, or for some people, it's the fear of contracting COVID in the future. And for other people, it could be not being able to socialize, like going to bars and parties and all that. So I think it helps if you identify the primary stressor within COVID. So what is the root cause of the depression? So if you can find that out and tackle that, I think it'll help the patient better, I think. Thank you.
Excellent, excellent. Dr. Khalid, how about you?
Definitely, we talked in general, so the topic is quite big. But if something I would like to share my final thoughts is that whatever we said, it will continue to be in general terms. So the best thing when it comes to the individual, allow them to speak, and let's not to jump into conclusions and offer an immediate solution, but let them talk. Let them express themselves and provide support before jumping into conclusion by solutions. Because sometimes people, they need just to talk and express themselves and maybe not necessarily looking for answers immediately. So this is the thing I would like to share.
Thank you. Shemine.
I think for me, it's find your spiritual practice, find that connection to the self, other or other than human, whatever that looks like and feels like for you. And I think acknowledging that the way that you cope day to day might look different. So today it might be going out for a run, tomorrow it might be having coffee with a friend, and allowing your body to express and connect to self, other or other than human in a way that is meaningful in that moment.
Thank you, Shemine. And Neda, any last thoughts?
I think everybody mentioned perfectly everything, covered everything. Let me add it that I think let's get creative. Let's create something, no matter what. It can be a new dish. It can be a short story. It can be a piece of art. Anything we can. I think Picasso said, if I can remember perfectly, that the art is washing the dust of daily life from our I don't remember perfectly, but from our souls. I remember it now. So dust of all these daily life pressures of our souls.
Excellent. Thank you. And I just want to thank everybody for tuning in. Hopefully you got some really great information from our esteemed panelists. Thank all of you for your time, for your knowledge, for your perspective and your professionalism. So everybody, and this has definitely been a topic on my heart. I come from that long line of mental illness on my mom's side, and I've suffered from depression. Unfortunately, my daughter does as well, and so does my son. And so this was really, really affirming in a lot of things that we've done over the years, but also just to give hope for somebody out there that might be going through this. You know, the last thoughts that I'll have for our audience is be that safe space, allow creativity, get out there and move. Don't allow yourself to just sit and waste time, and bring others with you. Be that person to help change that other person, because you never know whose life you could be saving. And so again, I appreciate your time, and yeah, thank you all.
Thank you so much.
Thank you.
Thank you, everyone.
Wonderful.
Everybody,
Thank you.
Thank you.
Great
Yeah,
session. Thank you.
please connect with our
Thank
panelists
you
on
all.
social
It was
media.
wonderful.
Please connect with them on social media. Please reach out to them. I'm sure they're open to have conversation. So